my name is Grant, and I will be presenting my virtual reality treatment for glossophobia, or the fear of public speaking. To begin with, the participant would start off in an observation room looking into the empty presentation room. This would allow the participant to become accustomed to the presentation room without having to step foot in it. Once they were comfortable enough, they would be encouraged to walk into the presentation room and up to the podium. From here, they could then start presenting to the empty presentation room. They could present from one of three scripts given to them, labeled A, B, and C, with A being the least difficult and C being the most difficult. All presentations had three components: the introduction, the body, and the conclusion. The body part of the presentation was meant to be the most difficult and cause errors in the presentation, which could give the presenter some form of anxiety. The participants were also encouraged to look at the presentation they were given and then give the presentation, as to not have the participant just read directly from the script and not make eye contact with the audience. They were able to look back and forth from the script if they needed to, so they could maintain eye contact with the audience. Once they were comfortable with giving a presentation to an empty presentation space, they were then encouraged to increase the size of the audience. They could either start with a small group or a large group. They were told to start with the group that caused the least amount of anxiety for them, as some people are more anxious with smaller groups and some people are more anxious with larger groups. We're going to start with a smaller group to begin with. Here, the participant has one member in his audience and could give the presentation that he had been practicing earlier. After he felt comfortable with that, he then could increase the audience further. Here we have a medium-sized group. So the presenter could then present presentation A again, which they had been practicing, or they can move on to presentation B, which was more difficult. This had a scripted introduction, a tongue twister for them to read, which was supposed to cause them the most errors and therefore possibly more anxiety, and a scripted closing. And again, they could look back and forth, but were encouraged to make eye contact with the audience members. Finally, they could increase the size of the audience further with the biggest size that they could get. They could then again do the presentation that they have practiced, or they could move on to their final presentation, presentation C, which is supposed to be more open-ended, and it had an introduction, a body, and a closing. But these were meant to be open-ended, so the participant had to kind of come up with what they were going to say on the fly. The final portion that the participants could do was supposed to be a committee or conference type setting, which was designed to be organized that it might simulate an interview or, again, a committee or some sort of conference. But all of these were supposed to be done in the lowest anxiety provoking, which was the observation room, then the empty presentation room and presentation, and then increasing member size of the audience. All of this was so the presenter and the participant could get practice presenting to different size audiences and hopefully reduce their fear and their overall anxiety in presenting.